everybody. Tim Lerch here. I'm here with my friend Geoff Yule. Geoff Yule is a doctor of hand stuff, and we had this video a couple of weeks ago about the woes of arthritis and hand problems as we get older, something that I'm experiencing a little bit of. And Geoff is a world-class hand surgeon, recently retired, and he's going to maybe help clarify some of these muddy waters of what causes these things, what we can do about them, if anything, once they start to happen, good practices, things to avoid, things to do, those kinds of things. So thank you very much, Geoff, for coming here and sharing your wisdom with us. How about if we do this? My demographic is not the kids, okay? I got to admit that. So a lot of guys, men and women who are at an age where hand problems in general, particularly when playing guitar, are kind of common. A lot of my students are going through stuff, whether it be tendinitis or arthritis or some combination of the two. I suppose that's also possible, right?
That's true.
Body position, hand movement, freedom of movement, avoiding repetitive stress, all these kinds of things. So I just played a little bit, and you got a chance to look over my shoulder while I was doing it. I wonder if you have any observations about guitar players in general. I know you showed me this picture. We're gonna put up here of John Williams, and our friend Keith Richards, these kinds of things. But perhaps you have a little bit of something to share about it, just to get the ball rolling today.
Well, I mean, it's an occupational hazard to notice in guitar players how they're using their hands. To me, it's a miracle. I mean, I have dabbled in guitar playing and can't really play the guitar. And I noticed when I was playing myself, just this kind of stresses. Yeah. And when we think about the kinds of things that cause hands problems, many times it's repetitive activities and the stress on the hands. And there's parts of guitar playing that just seem inherently stressful. Although you're so smooth.
I try.
It's different. But
I try to be a little smooth, and I've worked hard on trying to eliminate unnecessary pressures and stresses. I talked in the last video about softening the touch, all these kinds of things, which you probably noticed when you tried to play guitar, that you were trying really hard to do it.
I think once you get over the spasticity of trying to do the fingerings and deal with the frets and so forth, it is inherently stressful to the hands, and so managing problems I think it's just part of the deal, and it is part of the deal for getting older is to have some problems.
Yeah, exactly.
And we talked beforehand about, maybe we do a bit of a focus on arthritis.
I think that might be important. We could do more than one of these, and this one maybe can be the arthritis version.
A really sensible place to start is to recognize that particularly osteoarthritis is very, very common. It's about 1 in 7 people in the world have some manifestation of osteoarthritis or will.
Could you nutshell it for us? What is it? What's going on in our bodies?
Yeah, so osteoarthritis, we don't really know exactly what the mechanism is. It's a bit mysterious. It seems to be associated with inflammation. It's very strongly genetically inherited. It's really a miracle that our bodies work as well as they do. And unlike a hinge that you buy at Home Depot, your joints over time, they repair and they renew to an extent. And what appears to be the problem is that not everybody equally over their lifetimes will repair those joints and have a totally satisfactory joint. I have seen patients in their 70s and 80s that the x-rays just look pristine, but that's not the most common route. And, the kinds of things that bring on the changes include stresses on the joints.
Yeah, so someone who's laying carpet their whole life or working in the cold with wrenches under the hood of a car or pouring concrete or something, they're likely to have problems with their joints deteriorating in that way, right?
To be honest,
no.
I think guitar playing is really focusing energy on small joints.
Yeah,
So
it's
to be
like
clear,
gymnastics
Yeah,
from
so
the
to-
wrist.
so to be clear, osteoarthritis will typically initially involve the joints at the end, the distal joints, the distal interphalangeal joint. And then secondarily, perhaps, you start forming some at the next joint. And an important differentiation here is that rheumatoid arthritis is an autoimmune disease in which your body is recognizing all your joints as foreign to an extent. And a really common way that that comes on is that these joints, the metacarpophalangeal joints, in both hands are typically involved early on. And very typically, patients describe that they feel stiffer in the morning and they work it out and it feels better. That's called gelling phenomenon. You may have some of that, but osteoarthritis tends to be more of it aches more when you use them more because they're not particularly good joints. So I think it's important. And again, I'm not going to render medical advice.
Thank you.
I'm the retired surgeon. I'm not actually endorsing any products or any specific techniques. I, of course, urge everybody to see their own doctor. There's a host of good hand surgeons in the world. But in any event, I think it's important for people to understand that rheumatoid arthritis in 2022, there are some really good treatments for it. And so it's important to diagnose early. So again, it's a matter of it behaves differently. It tends to involve these joints. And because it's your body's recognition of the lining of the joint as foreign, it tends to be both hands, not just one. It doesn't tend to be focused because the problem isn't overuse. The problem is an autoimmune disorder.
Okay, so when you said the joints are considered to be foreign, that means that the body's attacking itself because it thinks it has something to attack.
The immune system is
yes.
attacking
Okay.
it, and it causes a host of problems.
Yeah.
And is very treatable with modern medications. That really wasn't true even 30 years ago. And so it's important to know that that's a danger sign and be seen if you have problems of that sort. And maybe more of the focus can be on osteoarthritis, which is it's a more mysterious origin. Frankly, we don't have any miracle cures for it. We don't have a drug that is the anti-osteoarthritis drug that slows or stops the progression of the disease.
But people use anti-inflammatories for this, right?
Yeah, so the one caution in anti-inflammatories is don't have bad kidneys, don't take too much, and not drink any fluids.
Yeah, right.
I myself take anti-inflammatories occasionally. I think if you're taking them chronically for a problem, it's probably time to be seen. Don't overuse them. They have a long track record of being relatively safe drugs over time. Tylenol, don't have a bad liver, and take handfuls of Tylenol. But Tylenol without the anti-inflammatory function can work as well or even better.
Okay.
Tylenol is an excellent
yeah.
pain reliever. So if the issue is pain or being able to endure your playing, it's certainly something you can use. I'm not expert in natural medicine. I think what I can tell you is that glucosamine and chondroitin, the studies are difficult to do, to tell you how effective those things are. Anytime you're studying something where the endpoint can be things like pain, that's very subjective. And, you've forgotten more about meditation than I'll ever learn. But your attitude, your stoicism really counts as you age. And I'm certain there's a part of this that is acceptance. A statistic that I'd commonly quote is that after the age of 40, most people pick up one new chronic ache or pain every decade till they die. So if you're 60, you're average if you have a couple.
Right. Well, the old joke is if you wake up in the morning and you're not in pain when you're about my age, then you're dead.
It's normal, and I would urge people to think about stoicism and meditation and other relaxation techniques.
In my last video about this subject, the thing I feel like I'm relatively expert at is the condition of our mind when we're playing. And my take on it is you can still play, but you can avoid doing the things that are making things worse. And a lot of that is our attitude, that kind of grab and kill, left hand, where we're gripping. And, I made a little thing the other day. I don't think I posted it on YouTube yet. Someone asked me about thumb position and pain. When you're playing, if you're playing Louie Louie for 4 hours at a time, right? This thing right here, pushing and gripping, you get pain in here.
Yeah.
Amateurs or novices would. There's even some people who aren't novices will do that. And so what I showed was that I move my thumb very freely around. I keep it moving. I don't grip it and always hold it the same way, because that creates this sort of almost like this isometric freeze up, and so I'll move my hand. Let me see if I can turn it. Well, I'll show you, as I might say. I even played a note with my thumb, reaching around. So all these different movements of the thumb to try and keep it active, so it's not going to be painful because it's been stuck in the same position for an hour or whatever it is.
Sure.
So those kinds of things I think I can speak to, because I deal with them in my own playing, and I watch my students deal with them as well. But what I am not clear about is the stuff where you can help us understand what's really going on. Like, for instance, I have a question. You mentioned the rheumatoid arthritis. Now, there's some pretty famous players who have this condition. And here's a photograph of one of them. And
well, that's osteoarthritis.
Oh, that's osteo.
Yeah. So
okay, so what's wrong? Keith Richards has got this thing.
I'm not his doctor. I've not seen his test results.
Yes.
But if you look at the fingers and you look at these joints, they are highly distorted, highly swollen. It's not the case that if you have one, you can't possibly have the other.
Oh, okay.
So I guess I would have to study his
right.
metacarpophalangeal joints as well. But suffice to say that force and repetition over very long, use of the hands, more than likely coupled with at least some genetic predisposition, has ultimately come to visit him. And he still plays.
Yeah.
So how is he doing
Probably no worse than he ever did either.
He still plays.
Which is kind of an inside joke. Yeah, he plays great. Now, Keith Richards is great. Now, so that's osteoarthritis. That's the one that looks gnarly. You can tell. Now, so rheumatoid arthritis is more common amongst people who are getting on in age?
Less common.
Less common. Oh.
Yeah. And so if your body decides that the lining of your joints is foreign, it's called synovium.
Okay.
Then you have it.
Oh, I see. Okay.
And there's a population that gets it very, very young, called juvenile rheumatoid arthritis. And then there's later onset rheumatoid arthritis.
So the kind that Mr. Richards has, that's just it seems advanced because he so obviously has it, and his joints are all knuckly and gnarly looking.
Yeah.
That's the more common kind. That's probably the kind that I'm starting to get.
It's 1 in 7.
Okay.
So
I didn't realize
1 in 7 humans gets that problem. And so we're not designed to last 200 years.
Well, Keith is, but
So if it's a matter of, the force that you're applying, I wonder whether you should not be Stevie Ray Vaughan and using the heaviest strings and the thickest neck.
Yeah.
Does it make sense to start noodling around on something that's easier?
Which is ironic because most people's first guitars are the worst guitar they're ever going to have. in terms of playability, and
acoustic.
that's why most people quit, because their first guitar hurts them so badly. But
Yeah.
there is something about there's an old debate about that's kind of become a YouTube trope where do you really need big strings to sound good? And well, Billy Gibbons uses skinny little strings and he sounds great, and B.B. King uses little strings and he sounds great. And so the verdict is, or the jury is out on that. Everybody has their own preferences.
Yeah.
I prefer to use relatively stout strings, but I keep my action very low, and I try not to overplay my hand, so to speak. So I keep things light. I try and float like a butterfly and sting like a bee, rather than be the Incredible Hulk smashing this thing over here. Even though my old YouTube name is Telly Basher, I'm actually quite gentle when it comes to it. We could probably talk more about arthritis now. Is there anything else you'd like to say about that?
Yeah. So conservative treatments of arthritis, of all kinds, things that you could consider. We touched on the value of Tylenol, anti-inflammatories. There's a topical anti-inflammatory. It happens to be called Voltaren.
Yep.
It's available over the counter now. Some people get some relief. You're kind of asking for it to do a lot to get through your skin and down into the joint.
Right.
But for some things, I think it's suitable. Reasonably safe kind of medication. You had asked me specifically about things like exercises and stretching. So I did you two favors. One, I shaved yesterday for the video today.
Okay.
And the second was...
Which I didn't do, by the way.
I tried to go to a good objective source of information called the Cochrane database, where they look at a bunch of medical studies to try to come up with the truth. And so they looked at a bunch of different articles on hand exercises and whether that helped people with osteoarthritis. As it turns out, if you have osteoarthritis of your hips and knees, it can be very helpful to get some low-stress exercise. Keep the joints moving is really valuable. It's objectively, people do better when they exercise those joints. So the question is that true in hands? But again, we're getting into difficult things to study.
Right.
It's relatively easy to ask somebody, so are you able to walk further? Then are you able to use your hands better? It's so...
Yeah, I have my own anecdotal, but that's exactly what it is, Yeah.
Yeah, so in order to measure that sort of thing is difficult. So the conclusion of this study of studies was that most of the evidence that says it's helpful is kind of soft.
Okay.
And you could conclude that either the exercises are helping specifically the hands, or maybe they're just helping you feel better. I should point out that if you're carrying extra weight, that is problematic. You would think that it might only be problematic for your hips and knees, but there may be something hormonal going on. So if you're carrying some extra weight, shedding that does seem to have some impact on osteoarthritis and its progression, even in the hands. Your exercises, maybe not. I can tell you personally, I stretch.
Yeah, right. I mean, I think, for instance, if I do better if I slowly warm my hands up. Even before I started noticing arthritis, I did better if I slowly warmed my hands up and got the circulation in these distant, satellites, to be sort of flowing. And I would imagine it may be not necessarily pertinent specifically to the arthritis situation, but just your hand function in general. When you wake up, it's a little stiff. When you start using it, it sort of starts to loosen up and warm up.
Well,
right?
when you mention warmth, I mean, I have to go to the value of warmth on joints that don't feel good.
Okay, that was going to be my next question. Very good.
So the science regarding ice and the science regarding heat.
Yeah, let's talk about that.
Yeah, so for acute injuries, sudden injuries, ice really is a potent, locally acting anti-inflammatory of its own that you don't want to cause any freezing injury from.
Right.
I tell people that routinely
Yeah.
regarding their use of ice.
People come in with frostbite because they tried to ice themselves.
Every few years, somebody straps it on
Yeah.
and goes to bed with it,
Oh,
and then
no.
they go numb and they don't realize it. So don't do that.
Don't do that.
But when I get my own injuries, I'll go for the ice first. And then there is value in heat, particularly later on. There's value for chronic arthritis sufferers. Some people love wax dips.
Yep.
That's a very
Or even
common
just
therapy maneuver.
5 minutes under a warm faucet, to get yourself to feel a little looser.
Hand warming in any respect can be helpful.
I've heard that very often alternating hot and cold can be helpful.
True.
And you made the very good point about not overdoing probably either of them.
True.
Okay.
Yeah. So that's called contrast baths.
Oh.
So this is popular in therapy generally. So there's a reason there's an ice tub and a hot tub in Major League Baseball and NFL locker rooms. I mean, they're doing that sort of thing. So my own personal variation on it is to have an ice bag and a heating pad and maybe watch a movie and go back and forth. And I'm not really aware of any science that tells you how many minutes of each. I mean, if somebody can post in the comments that they found an article that found there's definitely a number of minutes that's just right, and it's not just what your grandma told you, awesome.
Yeah, right.
But for me personally, it's like I'm starting to feel maybe a little discomfort from the cold. It seems like maybe it's getting excessive. I've got a heating pad ready to go.
Right.
And that's a fairly clean way that you can do it while doing something else. And devoting a little time to that, when you're hurting makes a ton of sense, especially if, you are looking to avoid drug therapies. The over-the-counter kinds of drugs, they do have a very long history. They don't tend to be toxic when used properly. Safety counts.
Yes. And the help of and guidance of somebody who actually knows something about this stuff might also be a good idea at some place along the way, right?
Yeah. And work on what you can from your guitar playing so you're not stressing your hands as badly. I mean, we generally talk about stress, force, awkwardness, and guitar playing has all of that.
Yeah, and sometimes, oddly, you can hear it when it's happening. You can hear uncomfortableness and stress and overplaying and all that. So having a good and wise guitar instructor to maybe point things out, or even just a buddy who has been playing a while as well. So someone can see something about the way you're addressing the instrument that you might not be able to see. With regard to your posture, with regard to the amount of force you're putting into it, and if your knuckles start turning white, you're probably pushing a little too hard. Okay, so now a couple of quick things, kind of like the lightning round here, to put the arthritis story maybe, so we can move on to something else.
Yeah.
A few other things that generally come up when the discussion occurs is anti-inflammatory foods or inflammatory foods. Any thing to say about that?
It's yet another one of those really tough things to study. I mean, if you're being honest with yourself, are you adhering to it? What did you do to identify what was problematic? When you're dealing with diseases that are highly variable and have natural cycles, if you have a cancer and it progresses over time, the end result is a marker. If you have something that goes up and down all the time, it's very hard to determine what is it that I'm doing. Am I changing my diet? Is there something else going on? Is my general mood and tolerance of this displeasure in a good place? I mean, is your head in a good place to deal with the infirmities?
Right.
Because the infirmities are natural. And nobody, it seems, gets out of this game without having some infirmities.
Right.
So I think
so your attitude, the attitude you bring, you have pain, but then the amount of suffering that you have might have a lot to do with how you keep your mind in relationship to the pain. So,
Yeah.
you know, the
It,
discomfort and versus this sort of mental anguish or something like that.
yeah. I mean, at the extreme end of that is something we call catastrophizing,
Right.
which is now I simply cannot do things, or I am really forlorn because I have this infirmity. And I guess the best thing I think people can do is just realize that they're in a world where they're not alone in this, and managing it is something that can be done, and people do it successfully. So there's no need to catastrophize.
Right.
It's not the end of the world. It doesn't.
And as guitar players, I think we have this beautiful sort of built-in thing that I think needs to be addressed, which is we love to play. And even if it's a little painful or uncomfortable to play, somehow the joy we get from playing might be just a nice medicine as well. And something I would just like to remind everybody, when I was 12 and I did this, I thought I was just like about as close to heaven as you could get, right? And so it sounds so beautiful. It's one finger. I could lose all the rest and I can still get a little bit of joy from... Right? So we have that built in. Even though it's a drag, if we compare how we are now to how we used to be when we were able-bodied, then we're never going to be happy. But if we just dig it for the moment that it is, the beautiful sound, and maybe we can recall what it was like when we didn't know how to do anything and we still amazed ourselves with some little thing, So that's my hope, is that the joy of the music and the act of playing music, the magic of it, is a kind of medicine for this situation as well.
And I don't need to tell you about Django's history.
Exactly.
The degree of dysfunction, the setback, it could have gone one of two ways.
Yeah.
I mean, we may never have heard of him.
Right.
And yet here he is playing fantastic music by totally inventing a style.
Yeah, that's right. Using what he had to. And plenty of people do. I mean, Tony Iommi with the band Black Sabbath lost 2 fingers in an accident. He put rubber dealy bobbers on there and he went after it. Jerry Garcia was missing a finger. Phil Keaggy, same way. There's a beautiful guitar player out of Nashville named Jack Pearson. And Jack has something going on where he can't play a couple of different conventional things. I think there was an injury along the way somewhere. And so he just thought of a new way to do it, and he's fantastic. So anyway, But there are definitely exceptions to this business that we have to be, have 4 good fingers and a thumb to make beautiful music.
Yeah.
Now, you have a prop, and I want to ask about this prop in light of another typical common ailment.
Yeah.
Which is tendon problems, carpal tunnel, tingling in the fingers, all that kind of stuff that comes not from a genetic thing necessarily or some mysterious degradation, but because of overuse or improper use, I think.
Yeah.
Can you talk about that?
So maybe it would be good to go in the direction of tendon problems first.
Okay.
I think a revelation for people might be that you don't actually have any muscles in your fingers themselves.
Right. Except this one and this one, right?
Well, out this far.
Yeah, right.
But if you really look at the fingers themselves from the MP joints to the tip, there's little or no muscle in them at all. Mm-hmm. And you're getting the action of...
Is this stuff just fatty tissue then?
Yeah. So that's been compared to a quilt of fat and connective tissue.
Beautiful.
Is what makes up our pads and the rest of the finger. It gives it that spongy sort of feel and doesn't allow just wild movement because of the fibrous nature of it also.
But no muscles. It's all being yanked from higher up.
Yeah. So, in fact, in your forearm. So
can we get a close-up of this little guy here?
Yeah.
Let's see. Let's turn it like that. So you can see that the center of the hand, it's these tendons, right?
Yeah. So
Connected to the
the
finger?
tendons are sometimes called leaders,
Uh-huh.
and they would go clear up into the forearm to make the action of flexing the tip of the finger. We'd have a muscle in the forearm. And as it turns out, there's actually two dominant tendons in each of our fingers, one of which flexes the tip and one of which flexes back at the PIP joint. And both of them are muscles in the forearm. And one of the problems in hands is that there are space constraints. Everything's kind of in a tight...
It's pretty crammed in there, isn't it?
Everything's crammed in there. So once you learn all of this anatomy, and that takes quite a while, what you ultimately realize is that with things crammed in the way they are, from the surgical perspective, a lot of the treatment has to do with making more space. I mean, this is a
opening things
recurring
up, yeah.
theme in hand surgery. You touched on carpal tunnel, tendinitis problems, and so on and so forth. So at the surgical extreme, most often what you're trying to do is make a space bigger.
Yes.
And that's a commonality to all of this. So when it comes to tendinitis problems, our tendons have to travel through pulleys in order to stay up against bone. You can imagine a scenario where if you had no pulleys and you were flexing your finger, that's all
It's
right.
over there.
Those are the muscles of the palm that just fell out. But you can imagine that absent pulleys, your tendon would be stressing up against your skin.
Yeah.
And so you have tight pulleys. You happen to have 5 of them starting here and then
Interesting.
all the way
Okay.
up the finger. So this leads to something called trigger fingers.
Trigger finger, yeah.
So with force and repetition, you can develop irritations that make the tendon into a lump. What's actually thought to happen is that the pulleys become inflamed through all this action. They begin to thicken, and then the tendon is trying to pass through the eye of the needle. It's been compared to the yarn going through the eye of the needle, so that you get bunching and you form nodules on the tendons that hang up, and it has a very distinct behavior of the finger locking. There's some variability to it, but the classic story is you flex your finger or you wake up in the morning, it tends to be worse in the morning, and you got a finger that's locked down.
Yeah.
And now that you've heard this, you know this is probably a trigger finger and probably doesn't have anything to do with arthritis.
Right.
Now that said, arthritis
Might be
can
happening
lead
there, too.
to trigger digits. This is absolutely true, but your kind of garden variety is just this kind of nodule forms on the tendon. And rest is valuable. So when are you going to rest, Tim?
When I'm dead, baby.
So that's a scenario where maybe you have to get by and hope that the inflammation goes down with ice
No,
and heat.
I joked about it, but I know that there are folks, famous folks, who got trigger finger or something, some other common things similar to it,
Yeah.
and they just had to stop playing, and it was sad, or they had to play nothing like the repertoire that they usually played, the high functioning repertoire.
Yeah.
Classical guitar players who probably put a little bit more, have to put a little bit more, they have a different practice ethic. They probably have a little bit more difficult instrument physically to play.
Yeah.
Often I hear classical guitarists having trouble with things like focal dystonia and trigger finger and similar types of things where they just can't get their hands to do the thing that they want it to do.
Yeah, the focal dystonia is the writer's cramp, which is, so this is probably neurological and leads to that kind of spastic behavior in the hand.
Yeah.
So that's probably off in its own
No,
corner.
yeah, we won't try to talk
So
about it. but it's
your
just one of
average
those-
trigger digit patient, you can try to splint, but how effectively are you going to
or
be
like
able
just
to do
basically
that?
straighten it out and hold it there for a long
Yeah,
time.
so every time that thing pops, it is stressful and it's a self-perpetuating process. So you can very easily find yourself triggering some and try to ignore it, and that will escalate to the point that the finger begins to lock. And if you sit around on it too long, then those conservative treatments just don't work that well. Steroid injection can be used. People have feelings about steroids. I understand that. They are liquid anti-inflammatories.
Yeah.
And used properly and judiciously, not particularly harmful. There's risk to everything we do. But for the person who wants to avoid a surgical effort, they can make sense, and they do have relatively high efficacy for this. And then there is a surgery for this in which we release the first pulley in the chain typically. It makes more room permanently. So we're back to we make more room.
Okay.
And so you shouldn't feel like your career is over if you get a trigger finger. They are manageable. It's one of the more readily managed problems in hands.
Oh, that's good to hear.
And there are stretching exercises. You can read therapy protocols, things that you can do. Those are all available online. And then hopefully you just get better.
Okay, so we talked about how a surgeon would go into your hand and allow passageways for the things that have become obstructed by natural process. Right?
There's plenty of other common tendinitis problems, but maybe one to touch on is at the base of the thumb.
Okay, yeah, this is important because we're guitar players.
Yeah, so the way we're hooked up here, the penalty that we pay for having an opposable thumb is twofold. We have a lot of movements that have to be done by these tendons that operate the thumb.
Let's see that. There we go.
And in the kind of classic anatomy, there's tons of variability between people what that anatomy is. You have a tendon that abducts the thumb or steals it away from the palm, and another tendon that extends this joint here, and then many times more tendons, all traveling through a relatively tight space found here at the thumb. So if you have a lot of aches and pains right here, and sometimes even a visible swelling in the wrist, that's called de Quervain's tendinitis.
Ooh.
Yes, named after Fritz de Quervain.
Fritz, I was going to say Frederick.
Fritz de Quervain described this. I think he was a Swiss doctor. But in any event, that's yet another example of the pulley, which its function here is to just keep the tendons aligned with the thumb no matter how you rotate your hand. You still need those tendons to be able to abduct your thumb and extend your thumb. You don't want them slopping around on your wrist. So here we have yet another example of a pulley. And the same things we said about trigger fingers apply. I mean, conservative treatments include things like splinting and holding the thumb still if you can stand to do so.
And let's say after an hour of serious practice, you start to feel a little discomfort down in that area. Would icing that area be a good idea?
It'd be appropriate.
So rather than, if this place is where the pain is, so I can think, oh, let's ice that, and that's still correct.
Yeah, no, that's
the
still
pain
true.
Isn't referring somewhere. Okay,
No,
okay.
you're trying to control local inflammation.
Okay.
I mean, patients intuitively know when they're really in trouble, right? The ordinary kinds of aches and pains from some degree of overuse, once you get to the point where it's not even necessarily the activity that provoked it,
it's just,
is causing symptoms all the time. If you're having a lot of pain in this location, probably a tendinitis. You've crossed the line, and now if you really want it to go away, it is another self-perpetuating process. Do what you can with respect to your playing, but do those conservative things to manage it. And yet again, there is an operation at the end of all of that, if it's necessary, to release the tendons and make more room for the tendons. And then there's tendons clear across the top of the hand in different compartments, but really, particularly for the guitar player, this thumb base is going to be one of the focuses. It's pretty rare to get tendinitis involving these finger extensor tendons. So there's a common muscle and common tendons called the communis that extends all of the fingers, and then special tendons for the index and the pinky or fifth digit. This is what allows you to rock on. You have independent extensors for those. doesn't tend to be a problem. I've seen very few cases in 25 years of people with significant tendinitis in here. So I think that covers most of the common tendinitis problems. But we had talked off camera about thumb base arthritis.
Yeah, that's
Yeah.
back to the arthritis business.
Yeah, so the tendinitis issue is back here at the wrist where this thing exists. And notice that is not where the base of the thumb is. The base of the thumb is here. So this particular
Do we
joint...
see that? Do we see that on the camera? Okay,
Yeah,
good.
probably so.
I'll zoom in a little, maybe.
Yeah, so in order to have an opposable thumb, we've taken on a joint with more freedom of movement, which puts more stress on it.
Yes.
And it so happens that with pinching maneuvers, the forces at work are really trying to drive this bone, the metacarpal of the thumb, out of joint all the time. So forceful, repetitive pinching can be problematic.
Hence a light thumb, ladies and gentlemen.
The light thumb.
We got to have a light thumb.
And so this is heavily genetically based. It is way more prevalent in women. So maybe male guitar players don't have to worry about it as much. But the symptoms are in the same neighborhood.
As that tendon thing.
Yeah, but you're having a lot of aching and particularly grinding that thumb around.
It's a joint thing.
Yes. So now we have an arthritis at the base of the thumb. And all of the things we've touched on previously are likely to have some effect on that. And at the end of that ride, if you just can't take it, there are a number of operations described that are actually quite effective and restore a lot of function for people who are having advanced symptoms that really limit function. I think when you're making a decision whether surgery is appropriate or not, wrapped up in that has to be your function. If you can still do the things you want to do with pain that's acceptable to you, why on earth would you have a surgery? Now, there are examples where you can let things get too far. Thumb base arthritis may be one of them. If you just let it completely fall apart, one of two things will happen. It'll either get so arthritic it doesn't move very much at the base of the thumb anymore, and your pain will diminish.
And then you're just fixed.
Well, it's not quite that disabling. One of the operations described for this is to fuse the metacarpal bone to the next one in line, the trapezium.
Okay.
So that's a compromise. There's supposed to be some movement there, but it's not devastating. For a guitar player, probably so. There's something called an arthroplasty that allows movement still. That's generally favored. The number of people who are a good candidate to fuse the joint, those are people who need to preserve their power grasp over other interests.
Right.
You wreck your thumb base at the age of 40 riding a motorcycle, and you break rocks for a living.
Yeah.
Maybe a fusion is your operation.
Okay.
You are an excellent guitar player, and you're just getting arthritis. It's maybe not the end of your career.
Right. I have another observation I want to throw in here just briefly. It has to do with the right hand, especially for a fingerstyle player. Fingerstyle means we use our fingers to pluck the strings. I think what has occurred to me in the past is we think our thumb goes to there, right? And when we're playing, we think. I see players that they work their thumb kind of like this, and it's almost as if they perceive it as the fulcrum or the beginning of the thumb is here.
Yeah.
And I kind of learned, and you just helped me support it, that the thumb actually is motivated much lower than that.
Oh, sure.
And even to the point of it being almost to the wrist where the thumb activates.
Truly to the wrist.
Right, to the wrist. And so if you're doing this in your right hand and you're thinking the thumb starts here and you're putting all of your energy there, you're going to start having a lot of extra tension and perhaps difficulties, pain, problems. But if you see this almost like the thumb can be almost seen as a weighted implement. I don't know how much it would weigh, but if you just let it go, it pushes right by the string.
Yeah.
So we can relax a lot more if we understand not only our thumb but also the source of our fingers' movements. So I have this exercise where I have my students rotate the thumb in an exaggerated movement, a big circular movement, and then bring the first finger all the way to the palm till it touches. And then while the other 3 fingers are pinned to the string. So the independence it's an independence exercise, but also a movement exercise. I'm not suggesting that we play that way, but I think it's very good to feel the full extent of the tool that we're going to be using to play.
Well, you're employing, when you're doing that, you have thumb musculature at the...
Yes.
Yeah, so we differentiate muscles that are acting from outside of the hand itself from muscles that are
pullers
within the hand.
Yes.
So the ones outside of the hand itself are called extrinsic. They're outside. We have intrinsic muscles. And when you're talking about your thumb with our model all detached here now, you can see you have a dedicated muscle to abduct the thumb. It's doing the same thing that this tendon I told you back here is doing. Why not employ its partner?
Yeah. So use both aspects.
Sure.
Yeah.
And similarly, you have a big muscle across the palm that's responsible for you being able to adduct, not abduct, not steal the thumb away, but bring it back. It's functioning right in here. And you have short thumb flexor musculature. I think they're probably trying to illustrate that with this. So again, you have one big tendon to an extrinsic muscle in your forearm, and you also have a small muscle in your thumb. Use both.
Yep.
If you can, for
Right,
sure.
right.
Yeah.
Just be aware that the thumb is functioning from a deeper place in your hand than maybe we might think of it. Is just, if we look at it visually, it looks like it starts here, and as a player, being able to use the power of your hand in a relaxed way is something very important to avoid these kinds of chronic injuries that we often come up with. So that was my little observation there. Thank you for listening.
Yeah, sure thing.
Wrap it up.
Yes.
Got anything else you want to say? Anything you can think of? Watch guitar players.
Well,
and they do this wrong or they do that wrong or whatever.
My primary observation is that, for the hand surgeon, I'm so envious of people who are able to use their hands in the way that people do. And I think guitar playing is that ultimate manifestation of people who are using their brains to operate their hands. To me, it's just fascinating to see. And
for me too.
I hope one day to be marginally credible on the guitar.
Oh, very good. Well, Geoff, I want to thank you very much for
You're welcome.
coming and talking with us here. I know this is a real interesting and important subject because, like I said at the beginning, a lot of my people in my YouTube tribe are older guys and women like myself, and these things are real issues, and to hear someone who knows what they're talking about talk about it is, I think, ultimately very helpful. So thank you very much.
You're very welcome. My pleasure.
How about you come back again and we do... maybe we can talk about shoulders and elbows and stuff.
Not really my area of expertise.
But you can stretch it.
Yes, I could stretch.
Okay,
yes.
because you went to anatomy.
Yeah.
Very good. Well, thank you very much. Thank you, everybody. Please support my channel by subscribing and liking and doing all that YouTube
like
stuff.
The thing where you...
Yeah, do the thing.
Where it goes dying.
Yeah, I don't know about that. I don't think it goes dying anymore. But anyway, thank you very much for your kind attention. I hope this was helpful for everybody.